use that resource and put it to prudent use. Why we are waiting for that report from SHA to be tabled in this House, members of Health Committee and Vice Chair Madam Mariam, you are here, is because we want to see now, after money has gone to these facilities, and remember, we passed the FIF law, Facility Improvement Fee, and we ring-fenced that fund, that it can never be used for anything else. You know, previously, Senator Mangatana, if you didn't know, you'd find county assemblies, because they don't know where to source for medicine from, but they know where to buy dust and maram from, Mr. Speaker. They will take money from health facilities and go and pour it on and inflate the budget of the roads department, because they can easily procure maram, but they don't know where to buy syringes from and other things. And we made sure that in the FIF law, we ring-fence the resources that are raised and the compensation that go back to health facilities to be purely for running health institutions. So it will be important, once you receive that report from CS Duale when he lays it in this House, for you to check Hola Sub-County Hospital. How much compensation have they received the last number of years? What has it done? Previously, remember that same hospital used to survive on perhaps 20-30% of that budget only. What improvement has the governor made in that health institution since that compensation improved? That is what we must begin to question. That is what we must begin to find out from these institutions. Because many of our health facilities today, especially the public ones, are receiving over and above 50 to 70% of what they previously used to receive. As it is today, Mr. Speaker, we must see improvement. We cannot allow hospitals to remain as they are, as captured in this particular report, Mr. Speaker. We must be able to see governors now allow patients get clean linen, use clean toilets, staff compensated, and not have staff that are asking for bribe from patients' families because they say we have stayed for 2-3 months without pay. Those must now be things of the past. And it is my hope that our colleagues from the Health Committee, by the time we come back in February, those are the reports that you'll be telling us so that we can appreciate. So that I want to carry the excerpt of the page that will have Kericho County, Mr. Speaker, and the facilities there, so that now you physically go and inspect and ask, who is the committee first in charge of this dispensary? You have received 60, 70, 80,000 from SHA. Previously, there was no such funds that were coming in. How are you using it to improve this particular facility? So that this SHA and our public health infrastructure, Mr. Speaker, can be seen to work and improve in making things better. Therefore, Mr. Speaker, in conclusion, I just wish to remind all of us that this is not a Meru story. This is not a Laikipia story. This report by our colleagues is a story of public health in our devolved units. And it is something that we must speak about boldly. The absence of mortuary facilities, Mr. Speaker, that you hear, like, for example, in, I think, Laikipia, they said a mortuary that was meant for 16 people was housing 61 bodies. It's what Senator Cherargei Chikili calls that you suffer in life and even in death you continue suffering. That you are squeezed in life and squeezed in death as well. That cannot obtain as a situation in our public institutions, Mr. Speaker. Therefore, I congratulate you, Senator Mariam Sheikh, and the leadership of the Health Committee, and all the membership that continue to do this, because as a house, we must prioritize healthcare. It is the one thing that common families struggle with. Many families are just one sickness away from total poverty. Many families, Mr. Speaker, once a member of their family has become sick, they are forced to sell land and do other things that are unfortunate because of this state of affairs in public health institutions. It is my hope that as this committee continues to show the reality in these institutions, things will get better. With those many remarks, Mr. Speaker, I wish to say that I support and congratulations to the Health Committee. Let us have more of such.
Thank you, Senate Majority Leader, Senator Aaron Turiot. I now call upon Senator Mungatana Danson Buya.
Mr. Speaker, I want to thank you for giving me the opportunity to make a comment or two on this report by our Health Committee. Mr. Speaker, I want to thank the Vice Chair, Honorable Mariam Sheikh, for very ably moving this report, and the Honorable Senator Cherargei for seconding this report. Mr. Speaker, I want to agree with previous speakers on this floor that in fact what was witnessed by our Health Committee in Laikipia and Meru counties is the same story repeated in our counties. And Mr. Speaker, we have a serious problem in terms of financing of our county hospitals. We have passed the law, and we have even said here in the fifth that we shall ring-fence financing for facilities. But, Mr. Speaker, governors are struggling with this. A lot of governors are still not giving the facilities their freedoms to use the monies they raise within the same facilities. So, Mr. Speaker, as we speak on this matter, we want to encourage governors across the country that they must support what the law is saying. There is no justification in breaking the law, taking the money from the health facilities and taking it to the county revenue fund. Mr. Speaker, I want to speak on a matter that has not been dealt on much in the previous speeches by my colleagues. Digital health records have become a serious requirement whenever a patient is being moved from one level to another level. Whenever a patient has an emergency, digital health records, Mr. Speaker, are critical. But this, again, has not been given the necessary support in many of our county governments. Of course, we know some county governments have taken this matter very seriously, and they have actually gone out of their ways to make sure this sector works. I keep referring to the county of Muranga and the governor who is there, a former colleague in this house, who has gone out of his way as far as digitization of health records and his entire governance system. It is to be commended and to be followed. Mr. Speaker, the digital health records are critical. Why? Because when we have those records, then the patients, whenever they are being admitted to another level, or if it is an emergency, then quickly the personnel who are dealing with that patient are able to quickly deal with the issue that has brought that patient there, and they are able also to know what kind of a patient they are dealing with. Mr. Speaker, many counties are still not digitizing their records. Many counties are still, people are still being given a small book to carry. And I know this because in my county, this practice is still happening in local dispensaries, in local health centers. People are not, there's no digital information, so that when someone is having to be referred to another level, then, Mr. Speaker, there is a struggle. Again, Mr. Speaker, there was a challenge that was found in Laikipia and Meru counties about the effectiveness of the referral systems. The referral systems were not working, and those county hospitals that are supposed to be referral hospitals, they are being overburdened even by cases which are really not referral, which means, Mr. Speaker, a referral hospital in Meru County, a referral hospital in Laikipia County, they are being treated as if they are hospitals of first visit. And Mr. Speaker, this practice must be discouraged, and it is because of the ineffective systems of referrals. This report has highlighted what is happening in Meru. It has highlighted what is happening in Laikipia County, but the story is the same for Tana River County. Again, Mr. Speaker, when people are being referred, the digital records are not there. There's no effective system of referring people, and patients, Mr. Speaker, are being asked to pay for the ambulatory services. Mr. Speaker, our patients from Tana River County, many of them, when they go to Hola Referral Hospital, they are being asked to go to Kilifi County Hospital for referral, and they are being asked to go to Garissa County for referral. And yet, both are referral hospitals. And Mr. Speaker, it has reached a point where our own patients from the county are being rejected in these other counties because they are asking, why are you coming to us and yet you have been given money like us? Mr. Speaker, what is happening now is that our patients, they have to tell lies that although my ID is saying that I'm from Tana River County, but in fact I live on the borderline between our county, between Kilifi County and Tana River County, or between Garissa County and Tana River County. Why? Because, Mr. Speaker, there is a problem in our county in Tana River, and this is a total failure by our governor. Mr. Speaker, our governor has failed to be responsive to all the issues that are being raised. Mr. Speaker, whether it is county health committee, a county assembly health committee, when they raise the issues, the governor is not responsive. The CEC for health is not responsive. The chief officer for health is not responsive. Whether it is ourselves as an office of the Senate, when we raise our issues on behalf of the people, again, there's no response. Whether it is the citizens themselves who are raising issues affecting health, there's no response. Mr. Speaker, a very sad incident happened very recently. On the 11th November 2025, Lulu Mohammed Hassan, a pregnant woman, was bitten by a snake, and he was rushed to Hola Hospital. And he's going there as an emergency, Mr. Speaker. Mr. Speaker, just an antivenom was required to stabilize that situation. How can a whole hospital, which is a referral hospital, fail to have an antivenom, Mr. Speaker? Protect me from the majority leader, Mr. Speaker. How can it be, Mr. Speaker, that a pregnant woman who is bitten by a snake goes to a hospital at 10 p.m. and there is no antivenom? And this is a county referral hospital. How can that happen, Mr. Speaker? Antivenom, Mr. Speaker. Mr. Speaker, how is that? A county referral hospital lacking a basic antivenom to control a snake bite. People have raised these issues. We have raised these issues. The county assembly health committee has raised this issue, even visited the county referral hospital. And I thank our health committee chair for the county assembly, the Honorable Semi Dumba. They have done what they can. But there is no response from the governor. There is no response from the minister. No response from the chief officer. Mr. Speaker, Ali Mohammed passed away. 10 p.m., no antivenom, she passed away, and the baby in her stomach also passed away. Tana River County, on 11th November 2025. And Mr. Speaker, today we are just a few days towards the end of the month. To date, Mr. Speaker, there is no response from the governor. He has never visited that family to say, we are sorry. He has never bothered to go to the hospital to find out what is happening. This is a governor who has allocated, from the money we gave them from the Senate, he allocated 1.7, Mr. Speaker, 35 billion to the health sector in that county. 1.73 billion, and they cannot get an antivenom, Mr. Speaker. This is the situation that we find ourselves in. A governor who does not visit any hospital. A governor who does not talk at all about hospitals. A governor who doesn't bother with the people's health matters. This is the situation we have. Yet, they have allocated 1.73 billion from the money that we gave them from the Senate. But wonders of wonders, Mr. Speaker. 1.7 billion for health sector, 1.53 billion goes to recurrent expenditure. 1.53 billion goes to recurrent expenditures. So what they have remaining is just 196 for development, a mere paltry 196 million for development. But today, if you go to ask any person in Tana River, including the supporters of that governor, they will tell you there's nothing happening in the health sector. Mr. Speaker, it is worse than Laikipia County, which we are discussing today. It is worse than Meru County that we are discussing today. And I've asked the Health Committee, through the Vice Chair, to make a special visit to that county, because we have a problem with a non-caring governor who does not bother about. I think after he listens to my speech is when he will appear there to take a photo. But this is the situation that we have. Terrible situation. Mr. Speaker, when a life is lost, even one life, it is too expensive for the county and the country as a whole. But when, because of just an antivenom, a woman loses her health and the baby inside, and you say nothing, and you are supposed to be the chief executive officer of that county. How does that happen, Mr. Speaker? I don't know. I don't know. But, you know, sometimes we say voters also sometimes also have to carry a burden for the decisions they make at voting. Because voters must also not just cry. They were there, they were voting, and they are voting a second-term governor who's doing nothing on the health sector for Tana River County. Mr. Speaker, we need to think about changing the whole approach to the health sector. I'm personally one of those people who really supports the idea that maybe all governors, and maybe extend to all of us, but governors in particular, who are supposed to be in charge of hospitals, there should be a law that says they must always be admitted in those public hospitals in their counties. And they must die there. If the other people are dying there, they must also die there, like other citizens there. Maybe we should think of a law that says they must be treated there. Their wives, their children must be treated in county facilities, because they need to test how it is to be in those public hospitals. They need to feel how our people are feeling. There are health records which, you know, I've talked here about health records. I've said they must be digital, not pieces of paper that we see still happening in our county. So they must see what is happening there. They must feel what the people feel. Mr. Speaker, failing to bring drugs to the people, Mr. Speaker, failing to even give them, forget about antivenoms, even Panadols, Mr. Speaker, in our county hospital. It is a shame. Mr. Speaker, I served in the Ministry of Medical Health as an assistant minister many years ago when we worked with Professor Anyang' Nyong'o. Professor Anyang' Nyong'o came to serve in this Senate and later on became the governor of Kisumu. But Professor Anyang' Nyong'o, in July 2023, he was admitted to Jaramogi Oginga Odinga Referral Hospital. And you know what? He carried a very serious and sensitive operation in that hospital, a hospital in his county. I wonder whether my governor what is his name again? Godhana, whether he will be willing to be admitted in Hola Referral Hospital like Professor Anyang' Nyong'o and undergo an operation there. Mr. Speaker, I think we need to have a heart for our people. And this goes to all governors. Some of you are doing very well. Some of you are taking this job as a joke. You think it's just another political thing we do. Governors are not really seriously politicians. Governors are not supposed to be political. Even in your speech, when I come for a Madaraka Day holiday, I can talk the politics I want. I'm a senator. But you as a governor, tell us facts and figures. This is what our governor never does, Mr. Speaker. They will never tell you how much money has been allocated, how much has been used, how much has gone to where. I think also another distinguished former governor, Kivutha Kibwana, was admitted in his own county's hospital. Distinguished people like this. We should honor these people, not these fake governors who are not doing anything, Mr. Speaker. Particularly my governor. Mr. Speaker, when this woman died and the people were all over, making noise, demonstrating, doing what? The least that he could have done is to go and say, oh, Mama, I'm sorry. Family, I'm sorry. He has never appeared, Mr. Speaker. What we hear is that he traveled to Brazil. And one wonder, what are you doing in Brazil? To learn how to play football? Because there are no reports that we see that come from all these travels. Just expending money, spending money, and there's nothing that comes back to Tana River. Mr. Speaker, we need to rethink about this whole health thing. We need to make sure that the governor, the minister in charge, the chief officer, whenever they are sick, whenever their babies are sick, whenever their wives are sick, they should be admitted to those hospitals in the county. And we should make it a criminal offense if they go to be treated outside the county. Because these people are killing our people. They are killing our people. You cannot tell me you allocate 1.7 billion and you can't buy an antivenom to save a life. Mr. Speaker, with all those remarks, I stand to support this report. I want to congratulate the Health Committee for the work they have done. And as I have said, I want them to come to Tana River so they can see what is happening in that place, especially the Hola Referral Hospital. That is now becoming a joke because it's taking all its patients. When you go there, you are referred. You are going for referral, you are referred again. So it's like a referral hospital. I don't know what to call it, Mr. Speaker. We want to see governors doing their work. And some people think that we are doing this for politics. I have no interest in running for governor. But they should just do their work. Just do your work, for Christ's sake. And appear with the people and talk to the people. You have people who are governors and they're disappearing from the county. They don't appear in their offices. They don't go to their homes. They operate here in Nairobi and Mombasa. Shame on them. Mr. Speaker, let us do something for our people. With those many remarks, I thank you for giving me this opportunity, and I support this report. Thank you.
Thank you, Senator Mungatana. And as a ranking member of the House of Parliament, is a proposal that you have made as regards a possibility of a requirement to have all those sitting governors to be admitted and treated in hospitals within their jurisdictions. You know what to do. Why can't you bring it upon yourself, a legislation that will guide? And I'm very sure with the very passionate submissions that you have made, you'll be able to convince us to deal with a law that will speak towards that, so that we support our referral hospitals in our devolved units. And now I call upon Senator, yes, he's there, Senator Okoiti Omtata, to also give his contributions.
Thank you, Mr. Speaker, sir, for the chance to contribute to this motion. I begin by congratulating the committee for having taken their time to go around the county and for having given us a report that largely exposes the failure of devolved healthcare. Mr. Speaker, hospitals are usually two institutions rolled into one. And this one, there's the catering services or the hotel services. Hospitals are hotels. There's a hotel component and there's a treatment component. And I would have loved the report to have segregated the two and then address them comprehensively so that you can isolate whether the main problem is on the medical side or on the hotel side of the institution. I say that deliberately because when they were unbundling functions and transferring them to counties, that question was not addressed. A hospital was looked at as simply an institution that did not have those very, very clear demarcations. And so, as much as it was possible to devolve the hotel sides, county governments can run hotel services. My question is, was clinical medicine devolved? Another question that I would like the committee to do is maybe to do some studies around the world, and in a system like what we have, a polity like Kenya, what were the viabilities involving clinical medicine? I look at the case of a doctor who has spent maybe 8 or so years training, and they need exposure. They need further training, need to go for sabbaticals. They need all these things to keep abreast with the fast evolving medical world. Being sent to a county, what are the career opportunities of this person? for growth within the setting of a county. If it's in Busia, when will he learn to deal with the challenges that may be in Moyale, the diseases that may not be in Busia? And if it's in Moyale, maybe how will he be exposed or she be exposed to these other terrains? So the litany of failure that I'm seeing in this report is an invitation to this House to take a deep breath and ask ourselves, why is devolved health not working? Two, why are personnel in health, especially the doctors, very, very frustrated and not motivated? Then we should also go further and ask ourselves, why would a hospital like Busia Referral Hospital have a pharmacy that is not stocked, but right outside the hospital you have got about 5 private pharmacies that are stocked, that if you did further interrogation, you might find they could be linked to people who work in the referral hospital. We could also go back and ask ourselves, why did the government stop branding its stores, medical supplies, gloves, and what have you, to a point whereby you cannot distinguish government stores from private stores? So it is very easy to pick a glove from a hospital and go and sell it in a private pharmacy because it's not branded. Why did the government stop branding medicines and other consumables that are used in hospital facilities? Could this be responsible for some of the big shortages we see? Because you see invoices, delivery notes, and all that, but there's no medicine in the hospitals. But the private pharmacies outside there are clearly well stocked. So I keep on wondering, would the situation stay the same if government stores were branded to insulate public goods from being stolen? The other thing I've had people debate on this floor, and we have been unable to distinguish NHIF and universal health care. NHIF was never meant to provide universal health care. NHIF was an insurance package for civil servants initially, so that government could provide certain services beyond the basic medical care that everybody else was getting to the civil servants. It eventually grew and began taking up other people. And it was a membership thing. So to say here that SHA is providing universal health care, which NHIF had failed, is again another problem. Even the design of SHA is not for universal health care. The design of SHA is for paid up members. And SHA becomes just an enhancement of what NHIF later became when it was changed from the National Hospital Fund to the National Hospital Insurance Fund. So that only those who paid enjoyed the services. So if you want to get serious with the question of provision of health care, the national government must be involved right from the clinics. Let the county governments deal with primary health care. Let the county governments prevent people from falling sick. Let them keep people healthy. Let them spray mosquitoes. Let them run maternity hospitals, because maternity pregnancy is not a disease, it's just a condition. But where there is a need for intervention by a clinical officer, a trained medic, let that be the responsibility of the national government. Even if the hospitals, even if the county governments are going to retain the hotel part of the hospital, the clinical medicine part, the part that deals with treating people, the part that employs doctors, it's my submission, it should go back to the national government. Let us set up the National Health Commission that was promised in Naivasha to be established through legislation after the 2010 Constitution had been ratified at a referendum. 15 years down the line, the commission has not been set up. Doctors are being left at the mercy of small units called counties. Secondly, we cannot have every county setting up a referral hospitals with all the sophistication, all the expensive equipment, all the expensive personnel. Let us go back and embrace the national health referral system. And if I'm not wrong, in the fourth schedule to the Constitution, the national health referral facilities were left with the national government. They were never devolved. Policy and national health referral facilities, health policy and national health referral facilities were left with the national government. And I think if you look at sections, paragraphs 23 and 28 of the fourth schedule to the Constitution, they clearly show you that. Unfortunately, when the transition authority, whatever it was called, was transferring functions, it interpreted national health referral facilities to mean national hospitals. And so they unbundled things and took it down. Senator Mungatana has asked a very good question. Whether his governor could go down to his local hospital in Tana River, just as the good Professor Nyang' Nyong'o did with the hospital in Kisumu. What Senator Mungatana is not appreciating is that Kisumu already ran a provincial hospital under the national referral facilities, which it was given. Tana River did not get that facility. So already Kisumu was a center of excellence, even before devolution, serving a region. It had a level 5 hospitals, and I think it was at that level. But if you go back to some of these counties that hardly had a hospital, you may not be able to ask that question. When we come to the question of universal health care cannot be provided using private hospitals. Because what is happening in this country is that the private sector is marching forward. Private hospitals are all over, but their motive is profit. If I look at countries where we have got proper universal health care, beginning with Britain, I think from 1948, you go to Canada, most recently you go to Thailand, look at their model. The first ingredient is functioning public hospitals. The hospitals are well run, they are well equipped, there's proper personnel, the environment is good, and the state then provides Medicare at cost. It only pays the salary of the doctors and other workers. It buys medicine in bulk. The medicine is controlled. It cannot just leave the system. Even here we had it. We used to brand our medicines. You could get a GK tablet. You can't sell it on the open market. So, in the absence of functioning public hospitals, it's a mirage to talk of universal health care. NHIF was looted not by public hospitals, but by private hospitals. They're the ones who inflated bills, they're the ones who manufactured things, they're the ones who subjected patients to unnecessary medical procedures. And today, if you go to any hospital, any private hospital in this country, you are like, and you have got a good insurance cover like the one, Mr. Speaker, you enjoy, you are likely to be taken through a regime of tests and even be put on bed rest, even be detained for 2-3 days, so that they can bilk the insurance cover, so that they can siphon money out of it. And so, SHIF, NHIF have similar designs running on private hospitals. And this is what we call, what neoliberalism has done. That's what structural adjustments did. That's what the IMF does. It reduces a government to a tax collector who provides no goods and services to the ordinary citizen. And so, Mr. Speaker, other than complaining about the sorry state of affairs in our hospitals across the country, maybe this House should bite the bullet and form a committee that can can onboard various expertise and even do world tours to check out on how universal health care is provided. And then, from those who are successful like Britain and Canada and Thailand, and I put in Thailand deliberately because it's a third world country with a very, very young universal health care policy that is working effectively, but that is directly, it is funded by taxes. All you need to be is to be a resident of that country. If you happen to be not a proper resident, but you will be given emergency treatment if you are an undocumented alien. But here where you are going to have a scheme whereby we don't have functioning public hospitals and we are using premiums and there's an insurance scheme, it's just going to be looted. And we have seen the reports coming saying that there's been a lot of looting of that scheme. I'm not saying it's a good scheme or a bad scheme. I'm not giving a merit judgment on the SHA and the social insurance fund, health insurance fund. I'm just stating that, good or bad, the money that is being raised from Kenyans is being stolen by private hospitals. And to stop that, we must fix our public health sector. We must get properly functioning clinics, dispensaries, level 3 hospitals, level 4 hospitals, level 5 hospitals, and the state must be involved. The national government must be involved because health is in the Bill of Rights. The Bill of Rights cannot be left, its enforcement cannot be left to one level of government. Under Article 6, the national government is supposed to provide its services on the ground. So let us see a situation whereby we relook at health. We set up the National Health Commission to deal with the human resource so that doctors can be taken care of, they can have chances to grow, they can be transferred from one county to another, centrally, just like teachers are transferred. And then let us go back and brand our medicine and government stores, other government stores and supplies, so that it is not possible to take a tablet or a glove or a syringe out of a hospital, for a public hospital, into the open market. We have to do these small things, these small common sense things, so that we ring fence the public hospital, we put our doctors back, we equip these things and fund it directly with our taxes. The Abuja, Kenya is a signatory to the Abuja Treaty, which requires 15% of our budget to go to health. The last time I checked, we were doing way low, below 10%. If we were to put 15% of our budget into public health and do the necessary thing, and even including interpreting national health facilities, not to mean national hospitals, but also to mean a clinic in my village, so that the referral system can work. And by referral system, Mr. Speaker, sir, I mean that the centers of excellence like Kenyatta, the lower levels, level 5 hospitals, level 6, level 5, then level 4, then level 3, to the dispensary, to the clinics, are all intertwined and are sharing the limited resources, be it personnel, because some of these diseases require very high specialized training and are very rare, so that we are able to share these resources in a way that we do not invest too much in an area that we shall never utilize.
Give Senator Omtata 30 seconds to conclude on this.
Thank you, Mr. Speaker. So that you look at Madara as a center of excellence for mental health. It's a level 4 hospital. It's not a center of excellence, it's not the level of Kenyatta, but it's a center of excellence of mental health. In my own county, skin disease in Alupe, a level 4 hospital. Spinal injury here in Hurlingham, a level 4 hospital. So when we talk of national health referral facilities, we must interpret them to mean the network of all hospitals, clinics, dispensaries that could deliver health care at cost and that could ensure we can have universal health care. The idea that counties should take over hospitals and maybe run them like silos is one idea that is very expensive, it's going to fail, it has failed, and let this House bite the bullet. With those few remarks, I support the motion, and I pray that the committee considers the amendment, the proposals I've made, so that the report can be enriched. Thank you, Mr. Speaker, sir.
Thank you, Senator Omtata. Senator Okenyuri, Esther.
Thank you, Mr. Speaker. I also want to support the motion that was moved by the Vice Chair of the Senate Health Committee, Senator Mariam Omar. Mariam continues to distinguish herself in the roles assigned to her, and I'm very proud of what she's doing as a previous member of the Health Committee. Mr. Speaker, I wish to comment that what we are seeing in Laikipia and Meru counties from what the Health Committee oversight shows is a replica of what most county governments are undergoing. Mr. Speaker, the essence of devolution was to bring services closer to the people. So I want to believe, in as much as we have the shortfalls we are seeing, this is a call to action that we actually need to put our heads together and ensure that health is working for the people at the grassroots level, Mr. Speaker. When I actually look at the observations in, let's look at Laikipia County, Mr. Speaker. In Laikipia County, the county has Nyahururu Hospital has a capacity of 18 in the mortuary, but on the day the visit was conducted, Mr. Speaker, they had more than 61 bodies. What does that show you, Mr. Speaker? Counties need to prioritize allocation of resources to such areas so that we can decongest even the mortuaries. Mr. Speaker, when someone is dead, we need to give them their dignity even in death. Congesting bodies in mortuaries in that manner denies the bodies their dignity even in their last resort, Mr. Speaker. Mr. Speaker, in the same facility, we have newborn children who are being put in boxes, Mr. Speaker, for lack of cots. Senators who visited Laikipia County gave narration and accounts of having seen newborn babies being put in boxes. Mothers who are pregnant sharing beds, Mr. Speaker. This might not be seen as critical because maybe some of those are not women, Mr. Speaker. But if they are not your wives, they are your sisters, they are your mothers, Mr. Speaker, and they need the dignity they deserve even when they are bringing life on earth, Mr. Speaker. Mr. Speaker, previously, as a member of that committee, we conducted most of these site visits. And it's evident even the staff in those facilities are not motivated, Mr. Speaker. So apart from county governments preferring that most of their budget is going to recurrent expenditure, we are still seeing that the staff in those facilities are not motivated to undertake their roles. And what we see, some might not even rush to handle emergency cases, and we end up losing lives. Mr. Speaker, the issue of doing physical and manual recording, Mr. Speaker, we need to shift from that because you need to keep previous patient history, Mr. Speaker. So you visit a facility, and when you ask a nurse, how many mothers do you receive on a daily basis for delivery? She or he will quickly mention and say 5, but they have no records to show the same, Mr. Speaker. So these are some of the issues we need to compel counties that specific funds are used for specific functions, Mr. Speaker, because what happens, the moment they allocate funds and when they are working towards the supplementary budget, they quickly reallocate that money to other functions which were never intended for, Mr. Speaker. Mr. Speaker, a lot of emphasis is now being put to the teaching and referral hospitals, and we are forgetting the level 3 and dispensaries, which are at the lowest level, Mr. Speaker, where a patient should get first support before they are actually transferred to a teaching and referral hospital, Mr. Speaker. So the observations and recommendations here, Mr. Speaker, should not just end in Senate. We actually need, I don't know if it's the Health Committee, which again needs to now fast track and follow up implementation of these recommendations so that we don't debate this report and it ends here, Mr. Speaker, because you see, the visit was conducted in June. We are debating this report in November, almost December. By the time we follow up implementation, it's another election cycle is up, and members will be following other issues, Mr. Speaker. So, Mr. Speaker, when you actually look at most of these issues that have been raised by the committee, look at the issue of having expired drugs still being dispensed in those hospitals, Mr. Speaker. KEMSA needs to crack the whip or even conduct audits. Because when you say we have shortage of medicine and still on the other hand, we have expired medicine which is being dispensed to patients, that actually calls for serious attention, Mr. Speaker. We need to look at how disposal is happening. When you look at the report even shows photographs of how medical equipment and medicine is being disposed just outside in an open air, Mr. Speaker. This is a serious threat to the existing community, Mr. Speaker. And this is not just in Laikipia. So many other facilities in other counties are doing the same. So the Pharmacy and Poisons Board, I think, needs to swing into action and look at what is happening in the different counties so that we curb these environmental risks before our people are attacked out there and those in hospital, Mr. Speaker. Mr. Speaker, the other critical issue that has been observed is we have a shortage of ICU, Mr. Speaker. when you have very few of these and poorly equipped, Mr. Speaker, we will end up losing patients in hospital. Mr. Speaker, it's a very bad image. You get home, going to hospital expecting to be handled, and then in hospital, the ICU is not functional, so they'll not be able to admit you, Mr. Speaker. It paints a very sad picture, which calls for our efforts in actually pushing the county government to prioritizing such critical areas. The county assemblies, through the County Assemblies Forum, need to push the County Public Service Board to prioritize even promotions for their staff, so that we have staff who are motivated and ready to handle patients anytime patients are admitted, Mr. Speaker. So, Mr. Speaker, the report by the Health Committee gives a general image of what the status of devolution in terms of healthcare is, and is also challenging us to put a lot of emphasis, because I do not want to share the views of those who completely are disagreeing with devolution working. We just need to support and ensure we are cutting down on corruption and be more accountable and administrative, so that governors on their hand are ensuring that they are offering the governance that is required, and they are cutting down on shortages. The Council of Governors, on the other hand, needs to ensure that the laws that support facility improvement funds are actually adhered to, so that money that is, or revenue that is generated in those facilities is used for its intended functions and not directed to other functions, Mr. Speaker. So with those remarks, I wish to support that motion and encourage the Health Committee to tour very many other counties and expose the rot, because this will help in adjusting. You know, Mr. Speaker, sometimes there are quick gains you get by the committee visiting those areas. I saw sometimes back, when you visit a dispensary, maybe there are no curtains, but when they know that the committee is visiting, you'll find that the next day those curtains have been fixed. But, Mr. Speaker, we don't need the facilities and county government to wait for the Senate Health Committee for them to act. This is very basic, and they need to put their heads together in solving health, which is the most critical issue we are looking at as legislators representing ordinary people in this House. I thank you, Mr. Speaker.
Senator Maruma Jones.
Asante, Mheshimiwa Spika, kwa hii fursa umenipa ili kuchangia hii ripoti ya kamati ya afya ya Seneti kuhusu hali ya afya Laikipia ama gatuzi la Laikipia na Meru. Mheshimiwa Spika, niwape kongole kamati inayoendeshwa na Senator Mandago na naibu wake Senator Mariam kwa hii kazi ambayo wamefanya nzuri sana ya kutembelea magatuzi yetu na kufanya kazi yao ya uangalizi. Mheshimiwa Spika, niseme ya kwamba hii kazi wamefanya ni nzuri, na walikuwa na fursa pia ya kuja mpaka gatuzi letu la Taita Taveta, na tunangojea pia walete ripoti kwa yale ambayo waliona kule katika gatuzi la Taita Taveta. Lakini ile taswira ambayo wameichapisha hapa kwa gatuzi la Laikipia na gatuzi la Meru ni taswira ya hali halisi ya afya katika magatuzi yote ya Kenya. Mheshimiwa Spika, Mheshimiwa Spika, hii kazi ya uangalizi ya Senate ni vyema tuseme ya kwamba haifanyiki na seneta binafsi, na koti za Kenya zimekwisha ongea kuhusu hiyo tayari. Manake mara kwa mara kama maseneta wanalaumiwa wakati hakuna madawa na hali ya afya ama huduma za afya nzuri katika mahospitali, lakini koti tayari zimesema kwamba uangalizi ama oversight ya majukumu katika magatuzi haifanywi na maseneta binafsi, bali yanafanywa na taasisi ya Senate kupitia kamati za bunge. Na niseme kwamba ule uangalizi wa kimsingi ama primary oversight inafanywa na mabunge ya county, kwa sababu kama ni afya, idara ya afya inafanyiwa uangalizi na kamati ya afya ya bunge ya magatuzi. Nafikiri ni vyema ieleweke hivyo, kwa sababu mara kwa mara tunalaumiwa kama maseneti ya maseneta ya kwamba hatufanyi uangalizi katika zile huduma moja kwa moja za afya. Kwa hivyo taswira ambayo imechapishwa, Mheshimiwa Spika, na hii kamati yetu, kwa mfano katika hali ya waajiriwa ama wafanyikazi wauguzi, hii ripoti imesema kwamba wauguzi hawatoshi. Taswira kama hii ndio taswira ambayo iko katika magatuzi mengi ikiwemo Taita Taveta, na wale wahudumu wa afya wanajipata wamechoka, wanajipata kwamba wanafanya kazi masaa mengi bila kupata pesa zaidi. Mheshimiwa Spika, kuhudumiwa na mhudumu ambaye amechoka, wakati mwingine kuna uwezekano wa kufanya makosa, Mheshimiwa Spika. Lakini saa zingine pia tunalaumu magavana na mawaziri wao, kwa sababu wameajiri watu katika nafasi za kazi ambazo si za muhimu, na wakaacha kuajiri wahudumu wa afya ambao ndio muhimu zaidi katika magatuzi. Kwa mfano, unaweza pata madereva wameajiriwa katika kaunti, unapata madereva 5 wako na gari moja. Kwa hivyo ni lazima pia wakati wa uajiri magavana waangalie ili kuajiri watu katika huduma ambazo ni za muhimu kama huduma ya afya. Mheshimiwa Spika, kwa sababu ya kutolipwa malimbikizi ya pesa ama area zao, Mheshimiwa Spika, tunapata ya kwamba wafanyi kazi wanakuwa na morali kidogo ya kufanya kazi. Mheshimiwa Spika, mwaka uliopita tulileta kaunti yangu ya Taita Taveta kwa sababu wahudumu walikuwa wameenda kwa mgomo, na lile jambo walikuwa nalilia kwa ule mgomo ni kwamba hawajalipwa mishahara yao na hawajalipwa malimbikizi ya pesa yao ya mishahara. Kwa mfano, ile pesa imekatwa kwenda kulipa mikopo ama share zao za kwenda kwa cooperatives, na wakafanya mgomo. Walipokuja hapa, Mheshimiwa Spika, yule gavana akasema kwamba wamefanya mpango madhubuti wa kulipa ile pesa. Mheshimiwa Spika, la kushangaza ni kwamba hadi leo bado wale wafanyikazi wauguzi hawajalipwa zile pesa na mwaka umeisha. Mheshimiwa Spika, hivi ninavyoongea kule Taita Taveta wauguzi wanafanya mkutano kwa sababu wanataka kwenda kwa mgomo tena kwa sababu ya kutolipwa kwao kwa malimbikizi ya pesa. Mheshimiwa Spika, Mheshimiwa Spika, jambo la kutamausha, kwa sababu wakati wauguzi wanapolalamikia mishahara yao na magavana na kaunti haziangalii hayo masuala yao, basi shughuli za afya zinaendelea kudorora. Mheshimiwa Spika, nikiangalia hii ripoti wamesema kwamba majengo ya hospitali yako katika hali mbaya. Mheshimiwa Spika, nakumbuka wakati hii kamati ilikuja katika gatuzi la Taita Taveta, tulienda katika hospitali moja inaitwa Tausa Health Center, na tukapata ya kwamba yale majengo ya Tausa Health Center yamelaaniwa, Mheshimiwa Spika, na idara ya Public Works ya ile county walisema kwamba haya majengo yalaaniwe yasitumike. Idara ya afya wenyewe Public Health walisema kwamba haya majengo yasitumike. La kushangaza ni kwamba hadi leo bado yale majengo yanatumika, Mheshimiwa Spika. Kwa ile taswira ambayo imewekwa hapa katika hizo hospitali mbili ni taswira ambayo pia kule Taita Taveta tumeona kwamba iko pale pia. Mheshimiwa Spika, tumeona ya kwamba pia hizo hospitali mbili hazikuwa na ICU ama viumba, Mheshimiwa Spika, vitanda vya wagonjwa mahututi. Mheshimiwa Spika, ninapoongea pia kule taswira ni hiyo, picha ni hiyo kule Taita Taveta, ya kwamba gatuzi lote ama kaunti yote ya Taita Taveta hakuna kitanda hata kimoja cha wagonjwa mahututi. Mheshimiwa Spika, mwaka wa 2020 wakati tulikuwa na ugonjwa wa corona, Mheshimiwa Spika, kaunti zilipatiwa pesa ya kuhakikisha kwamba vitanda vya wagonjwa mahututi vimenunuliwa katika kila gatuzi. Tulipoteza hiyo fursa nzuri ya kununua, Mheshimiwa Spika, na wakati unapopata ugonjwa ambao unahitaji matibabu ya dharura katika kaunti ya Taita Taveta, Mheshimiwa Spika, basi lazima ukimbizwe Mombasa, labda kule Makadara hospitalini, ama upelekwe Kwale ama Kilifi. Na tuseme kwamba zile gatuzi ama yale magatuzi ambayo tunakimbilia sisi kama watu wa Taita Taveta walinunua vitanda vya ICU wakitumia pesa hizi za ugatuzi, Mheshimiwa Spika. Kwa hivyo ni kusema kwamba lazima lile gatuzi lifanye bidii ili wakati tunapopata wagonjwa mahututi, Mheshimiwa Spika, wapate kutibiwa ama kutibiwa ili wasipoteze maisha yao, Mheshimiwa Spika. Mheshimiwa Spika, hii ripoti pia imesema kwamba hospitali kama Nyahururu County Referral, Nanyuki Teaching and Referral Hospital, katika zile mortuary, Mheshimiwa Spika, unapata ya kwamba not katika mortuary but vyumba vya kujifungulia kina mama, ni kwamba kina mama wako wengi sana kushinda ile wale ambao wanahitajika kule, Mheshimiwa Spika. Na nafikiri hiyo ndio inaleta pia matatizo wakati wa kujifungua, Mheshimiwa Spika. Unapata ya kwamba wakati watu wamekuja kujifungua, kina mama wanakuwa wengi sana, na kitu cha kujifungua, Mheshimiwa Spika, ama jambo la kujifungua kina mama ni jambo ambalo linaweza kupotezea mama maisha, ama pia mtoto, ama wote wawili wapoteze maisha. Kwa kimombo tunaita maternal health, Mheshimiwa Spika. Kaunti nyingi Kenya nzima ikiwemo Taita Taveta, kina mama wakienda kujifungua wanapata vile vifo, na haitakikani miaka 60 baada ya kupata uhuru, Mheshimiwa Spika, kina mama wapoteze maisha ama watoto wapoteze maisha wakati wa kujifungua. Kwa hivyo kuonyesha